Joining us once again, Dr. Kevin Campbell, practicing cardiologist and assistant professor of medicine at the University of North Carolina. So how exactly could our bodies fight off cancer like we fight off the common cold?
Well, there's certain immune cells in our body with our immune system that attack viral infections like the common cold. These cells are called T cells. And what happens in this particular situation, in this experiment that we've talked about today, is that we pull these T cells out of the body of a patient with cancer. We use gene therapy to make them attack the cancer cells and then inject them back into the patient, and they go after the cancer cells.
This was a very small study in the Children's Hospital of Philadelphia. 21 young people received this treatment. 18 of them are in remission. I mean, could this be a cure for cancer?
I think that this may be well on the way to curing diseases like cancer. I think of it as personalized medicine. We're using your genetic material to fight off this particular cancer. This was done in leukemias, and in some children, they're seeing no cancer at 3 years. Not everyone, but the results look very promising.
They also tried it in adults. 37 adults, this is Penn scientists, 37 adults with leukemia, 12 went into complete remission, 8 more into partial remission. Do our cells remember, for example, if you reprogram them, put them back into our body, they fight off cancer, will they then reproduce and create cells that attack cancer for decades?
What they've done in this particular experiment has shown us that you can put these T cells back in, and they make 10,000 copies of themselves. And when they looked at the blood and the bone marrow of these patients down the line, they still had those T cells that remembered to fight against this particular cancer cell. This is really promising. The age of personalized medicine is how we're going to cure chronic diseases like cancer, like diabetes. I think that's where we're going.
Dr. Campbell, great to have you on the program.
Thanks for having me.
Here, Kevin, I want to hold this other one.
Okay, yeah, get the little black one. You know, it's amazing that cats have been shown to lower blood pressure and heart rate with their purring. I mean, right now, don't you feel totally relaxed as we're holding these beautiful kitties? It's been shown in studies that in people who have fractures, like elderly folks with hip fractures, that the purring of a cat is at a frequency that actually helps bones heal and knit together faster.
One look into their mesmerizing eyes, and your troubles start to melt away.
If we can help these patients without having to use medications and use beautiful kitties, it's a lot better way to go.
Joining us now, Dr. Kevin Campbell, a cardiologist and assistant professor of medicine at the University of North Carolina. And we've done a few of these stories, right, where extreme running is an issue for the heart, and you talked a little bit about that as a cardiologist. What did this Stanford focus study find about extreme exercise?
Well, they took a control group of sedentary people and compared them to these ultra runners, and they asked everything about their health, from their heart health, their lungs, their prostates, their sleep patterns, and then their training. And what they found was the ultra athletes did so much better in terms of heart attack and stroke risk, less than 1%, very, very low risk. Right, and that was the surprising part. The younger you are, the more likely you are to get injured. I think the older people have enough good sense to stretch, to not push themselves so hard, and to plod along and get the job done, but you don't have to sprint.
Experience with age is what you're saying. So as a CrossFitter, the big takeaway from these two studies is what?
Do something, get up, move. Make sure that you shake it up, not just aerobic, not just weightlifting, something together. everything in moderation.
We just have a little shot just to prove to our viewers.
Oh, my goodness.
But you're looking tough there, Dr. Campbell. I mean, it looks pretty serious. You like CrossFit, huh?
I love it. It keeps you young.
It keeps you doing something, that's for sure. Dr. Campbell, great to see you as always.
You too. Thanks for having me.
John, so 100 miles on the weekend, no big deal. That's what Dr. Campbell says.
Maybe on my bike.
That sounds pretty good, too.